and good afternoon. Thank you for joining me this Friday for our Lunch and Learn concerning the COVID-19 testing. Now, never ever in all of my life have I been asked to go and get tested for a disease I did not know that I had. Okay, I'm just gonna throw that out there. All right. Normally, and I haven't been to the doctor, just in full disclosure, I have not been to the doctor since probably 13 or 14 years, okay? So I've been very, very healthy. I tend to stay healthy. I tend to do a lot for myself to stay healthy. So I've not had any occasion to go to the doctor and be tested. But back in the day, before I got really smart, you know, if I felt bad, if I felt like my immune system wasn't doing what it needed to do, I would go and I would get a test at the doctor to see what was wrong with me. So they're asking, and we've been hearing this for months and months and months, to go down and have yourself tested for COVID-19. So I've been doing a lot of research, and this research comes from the National Vaccine Information Center, okay, which is very, very reputable. It's very, very sound, and we use a lot of their information when it comes to what's in a vaccine and what are the side effects of vaccines and that kind of thing. So today I'm going to talk to you about this coronavirus testing and why we in the Harris County, Texas area are in code red still, okay? So we're going to be talking about that. So health experts, now these are health experts, say that the PCR testing for SARS-CoV-2, the virus that is associated with the illness COVID-19, is too sensitive and needs to be adjusted to rule out people who have insignificant amounts of the virus in their system. The test threshold is so high that it detects people with the live virus as well as those with a few genetic fragments left over from past infections, but no longer pose a risk. It is like finding a hair in the room after a person left, says Michael Min, MD, an epidemiologist at the Harvard T.H. Chan School of Public Health. So this is not nobody. This is somebody who's really, really smart, epidemiologist at Harvard, okay? So this is important. In 3 sets of testing data that include cycle thresholds compiled by the officials in Massachusetts, New York, and Nevada, okay, they say up to 90%, 90% of the people testing positive barely carry any virus in a review by the New York Times, okay? So the reverse transcriptase quantitative polymerase chain reaction, which is the symbolism is the RT-Q PCR. This is the test. This is used to identify the people infected with the SARS-CoV-2 virus. It's a nasal swab to collect the RNA from deep within the nasal cavity. And remember, it goes all the way up into the sinus cavity. I don't know if you saw yesterday, I think it was yesterday, there was a report that a lady's blood-brain barrier was damaged because somebody shoved that Q-tip up her nose so hard that it actually caused her to leak cerebral fluid. She did have a skull deformity. I don't know if that played any part to it, but you read the report for yourself. I have not had that done. I am not going to have that done. So just throw that out there, all right? The RNA is reverse transcribed into DNA and amplified through 40 or more cycles until the virus is detected, okay? The result is reported as a simple yes or a simple no to the question of whether someone is infected. The U.S. Food and Drug Administration, FDA officials, state that they do not specify the cycle threshold ranges used to determine who is positive, and that commercial manufacturers and laboratories set their own threshold ranges. Okay, so the PCR threshold is too sensitive. Any test with a cycle threshold above 35 is too sensitive, says Juliet Morrison, PhD, virologist. These are people who study viruses at the University of California, Riverside. Quote, this is a quote, "I am shocked that people would think 40 cycles would represent a positive," end quote. A more reasonable cutoff would be 30 to 35, she added. Dr. Mina said that he would set the figure at 30 or maybe even less. Those changes would mean that the amount of genetic material in a patient's sample would have to be 100-fold to 1,000-fold of the current standard to test return positive to be acted on that. So let me break this down for you, okay? This means that the test is too sensitive. The virologist and the other guy from Harvard Medical School said the test is not a good test if you have ever had any coronavirus ever in your life. You could test positive on this test. There are 7 different strains of the coronavirus. There are patented coronavirus strains, which means that are man-made. Okay, I'm just going to throw that out there so you just kind of get that information there. They're saying that 40 cycles. Now, I don't really know what this means, but I'm going to use some creative, deductive reasoning skills. Okay, I'm thinking that the cycle is some kind of a filter to filter out all the different materials to see exactly where the RNA is. So if they're cycling 40 or 45, right? 40 or more cycles is what it says, that the filter is getting smaller and smaller and smaller and smaller until it catches absolutely everything that's in there. The epidemiologists and the virologists say that they would have it at 30 cycles or even less. That means it's going 10 cycles more than it needs to. And if it were reversed down to 30 or maybe even less, right, a patient's sample would have to have 10 times as many viral particles, even up to 1,000 times as many particles for that to test positive on the test. So I'm just going to throw this out there. Quote, this is a quote, "We have been using one type of data for everything, and that is just a plus or minus. That's all," said Dr. Mina. "We're using that for clinical diagnostics, for public health, for policy decision making. But a yes or no is not good enough. It's really irresponsible." Still quoting from this doctor. "I think to forego the recognition that this is a quantitative issue," he says. Okay? "The number of people with positive results who aren't infectious is particularly concerning. This worries me a lot because it is just too high." All of that is quote. All of that was quoted. Okay? So, officials at the Wadsworth Center New York State Lab have access to CT values from tests that they have processed. Now, the CT is the cycle times, okay? And they have analyzed their numbers at the time's request. In July, the lab identified 872 positive tests based on the threshold of 40 cycles. Okay, remember this number, 872 tests. With a cutoff of 35 cycles, 43%, that's almost half, 43% of those tests would no longer qualify as positive. About 63% would no longer be judged positive if the cycles were limited to 30. Okay, so this means that whoever designed these tests designed them, they are flawed. And if the tests were in the range that the virologists, who are the experts on viruses, okay, I'm not an expert on viruses, but the virologists who are said the cycles should be only 30 and perhaps less. At 30 cycles, 63% would test negative. Okay, that's a huge, huge drop in the numbers. Okay, in Massachusetts, from 75 to 90% of the people who tested positive in July with a cycle threshold of 40 would have been deemed negative if the threshold were 30 cycles. Dr. Mina says, and I quote, I would say that none of those people should be contact traced, not a one, he said. Quote, I am really shocked that it would be this high. The proportion of people with high CT value results, different doctor, Dr. Ashish Jha, MD, the director of the Harvard Global Health Institute. Quote, boy, it does really change the way we need to be thinking about the testing. I'm going to say this again. 85 to 90% of the people that tested positive would have tested negative if the threshold had been where the virologists think that the threshold should be. So what does that mean? That means, and you've got to use your critical thinking skills here, who benefits from people testing positive for this virus? Remember, the virus has a 99 point something recovery rate. The people that have died, and yes, there are people that have died, it is not the 200,000 that they're putting out there. Remember, the CDC came in a couple of weeks ago and said our numbers are wrong. Only 6,000 something, okay? I don't remember the exact number, but those are the only people that have died from the virus. The other multiple people that have died did have the virus, but the virus is not what killed them. They had a heart attack, they had a car wreck, they had whatever they had, but the virus did not kill them. So you need to ask yourself, who benefits from everybody testing positive for COVID-19? Now, obviously not everybody has tested positive. I had a lady that came in my office today. She had the test because she was doing some kind of medical procedure and she tested negative. So that not everybody does test positive. But when you're thinking that 85 to 90% of the positivity rate would not be positive if the threshold was at the correct level, it just makes me wonder who benefits from this, okay? So it says the gold standard in the PCR test leave many unanswered questions due to knowledge gaps. A positive PCR test does not tell the doctor whether the person is currently ill or will become ill in the future, whether they are infectious or will become infectious, whether they are recovering or have recovered from COVID. It doesn't tell them anything about it. All it says is it has identified a viral fragment from another corona infection in the past. Remember, your common ordinary cold is a coronavirus, all right? SARS was a coronavirus. The flu has coronavirus in there as well. So you've got to know what is behind these statistics, because I think we're just being manipulated. I'm just going to throw that out there. Don't send me hate mail. You're not going to change my mind, okay? It says the CDC reports that a person who has recovered from COVID-19 may have low levels of virus in their bodies for up to 3 months after diagnosis and may test positive even though they are not spreading COVID-19. Now, although the cycle threshold is not reported on the PCR test, new evidence suggests that the cycle threshold value would help better inform clinical decisions, particularly when testing in the absence of symptoms for COVID-19. Now, I'm going to just use me, okay? I have not had any symptoms. There is no reason for me to go down to the testing center to get tested for something I don't have a symptom for. I mean, that's just retarded. Why are we doing that? Okay? What is the motivation? Where is the common sense, right? I'm going to go to the doctor if I get sick. How am I going to know that I am sick? I'm going to know that I am sick if I have a symptom, okay? That's how I'm going to know. It says, okay, when a SARS-CoV-2 virus is detected after fewer amplification cycles, that indicates a higher viral load and a higher likelihood of being contagious, while a virus detected after more amplifications indicates a lower viral load. So if I'm going to be making health policy, right, I'm going to want a lower threshold because I want to catch and treat those people who have a higher viral load, who are more infectious, who are going to be more at risk of developing complications from this disease. So again, where is the motivation here? Okay, quote, "It is just kind of mind-blowing to me that people are not recording the cycle threshold values from all these tests, that they're just returning a positive or a negative," says Angela Remusin, a PhD virologist of Columbia University in New York. Quote, "It would be useful information to know if someone is positive, whether they have a high viral load or a low viral load," she added. In a study published by the Clinical Infectious Disease in May 2020, the author suggested that the viral load based on CT cutoff could establish whether inpatients have transmissible diseases and need to be retested. This would conserve valuable testing capacity, reagents, and personal protective equipment, and determine could determine when a patient could discontinue isolation. So this is another thing. Look at the money. How much money does it cost for everybody to be tested? Well, there's the new test, right? It's about $5 per person. But if you look at our program last week, or maybe the week before, we talked about the different costs of the test and how some people, so I think somebody's insurance company paid $10,000 for a test. So this comes out of your money. Maybe you didn't put it out of your pocket, but we all pay insurance premiums. And when they're paying that kind of money for those kind of tests, everybody's premiums are going to go up. So you have to follow the money, and you have to find out what's going on with this. This person says, or this research study says, that it's taking dollars, the reagents. Now, a reagent is a chemical that they put on the sample to see if it responds, to see if there is any RNA fragments there. So everything costs money. Everything costs money. Taking the CT value into account may help justify symptom-based strategies recommended by the CDC. Cycle, what was it called? The CT, cycle, I can't remember what it is. CT values may enable contact tracers to focus only on persons most likely to be infectious, which will become increasingly important as asymptomatic screening expands. Okay? Another study found that patients with a positive PCR test at a CT above 33 and 34 are not contagious and can be discharged from the hospital or strict confinement at home. Evidence from both viral isolation and contact tracing studies supports a short, early period of transmissibility. By accounting the cycle transfer values in context, right, the test results can be used in a way that is personalized, highly sensitive, and more specific, right? So the FDA kind of is in agreement with this, because highly sensitive PCR tests seem to be the best option for tracking the coronavirus at the start of the pandemic. But now, since for the outbreaks raging now, Dr. Arena said, what's needed is a coronavirus test that is fast, cheap, and abundant enough to frequently test anyone who needs it, even if the test is less sensitive. It might not catch every last one of the transmitting people, but it will sure catch the most transmissible people, including the super spreaders. And this is really what we want. We want the super spreaders to be stopped. If you're a super spreader, you need to stay home, okay? But the rest of us who are healthy don't need to be staying home. The FDA noted that people may have a low viral load when they are newly infected. A test with less sensitivity would miss these infections. But this problem is easily solved, Dr. Min said. Test them again in 6 hours or even 15 hours later. He said a rapid test would find the patients quickly, even if it was less sensitive, because their viral loads would quickly rise. People infected with the virus are the most infectious from a day or two before the symptoms appear until about 5 days after. But at the current testing rates, you're not doing it frequently enough for it to be of any value. So why are we doing this? Where are the critical thinking skills? When a coronavirus person tests positive, doctors typically tell them to stay home until the results come in. If a patient tests positive and faces a 2-week quarantine, that means they could spend a total of 3 weeks in isolation. This is a long time for anybody who has bills to pay or kids to send to school, and it's understandable that some people will continue to work until their results come in, which does not help any of us, okay? We want you, if you're sick, we do want you to stay home. All right. So as I said, this test only costs $5. $5. Now, I want to read about why we here in Houston are still at code red when, if you've been watching these videos, you know that the numbers are highly inflated. You know that even, as I said earlier, the CDC has revised its numbers down. And so why is Houston still at code red? And I think this was a Channel 11 news report that I'm going to look at right now. Okay, it says most Texas cities have downgraded their threat level. Okay, Dallas is in orange, Austin is in yellow, San Antonio is in green. That means no restrictions whatsoever. Houston is still stuck in the red. Why is this? Okay, so they asked a doctor at the Baylor College of Medicine. Now, you know that that is one of the finest institutions that we have in our area, okay? This is Dr. James McDivitt, I think. I may not have spelled that right. He is a senior vice president and dean of clinical affairs at the Baylor College of Medicine. He says, and this is a quote, "We've seen the rates come down. The hospitals are nowhere close to being in trouble. Daily numbers have improved and the test rates are better." Now, this was, I think, last week. So this is this is fairly current, okay? It says that the Harris County numbers are based on what? 5 factors. Overall hospital capacity, the percentage of beds used for COVID-19 patients, overall numbers of cases in Harris County, number of new COVID-19 cases, and the number of COVID cases coming back positive. Now, the doctor says, right, he says the hospitals are nowhere close to being in trouble. Daily numbers have improved, and the test rates are better. That means we are on a downward trajectory. He says, okay, if I were advising the county, this is a quote, if I were advising the county, I would say it is probably time to reduce the threat level because most everything is moving in the right direction. This is a direct quote from the doctor. Now, instead, Lena Hidalgo, who is our county judge, she says no. She addressed the issue and she even doubled down. She's sticking with red, stay home. Now, on my computer here, and my computer went dark because I wasn't looking at it, okay? So, threat level, okay? It says level 1, that's where we are on the red, okay? Level 1 says severe uncontrolled COVID-19 in Harris County, meaning outbreaks are present and worsening, and testing and contact tracing capacity is strained or exceeded. At this level, residents take action to minimize contacts with others whenever possible and avoid leaving home except for the most essential needs. So we are at that level. We are at code red. The doctor says we're not at that level because the hospitals are not overwhelmed. The testing, the numbers are going down. The testing positive is going down. So why are we still at code red? So this is what the commentator says. So what does this mean for you? Not much really, since the county can only recommend you stay home. Only Governor Abbott can mandate, and right now he is not doing that. You can find more information on readyharris.gov website, which is what I was just reading right now, that we are in the red still. You'll see as you're driving on the highway, it says you are in COVID level, threat, red. Stay home, stay safe. I'm just telling you, from a health point of view, isolation is not healthy. You have to be out in the general public, breathing, living, having your immune system have something to deal with, right? I don't want you to get sick. That's not what I'm saying. What I'm saying is when we are interacting with other people, we are sharing air, we're sharing bacteria, we're sharing different things so that the immune system grabs onto stuff, knows what it's looking for, and it makes your immune system stronger. Now, that being said, if you are obese, you are at higher risk. If you have heart issues, you are at higher risk. If you have COPD, if you are a diabetic, you are at higher risk. If you are in those categories, you need to stay home. If you're not in those categories, all right, and older is another one of those categories, I'll just tell you that the patient that was in today is in her 70s, has COPD, and tested negative. So I'm just saying, you've got to take care of yourself. The tests are super, super sensitive. The virologists say that the testing is not accurate because the threshold number is too high. And so hopefully all of our people will listen to this. I know this is not going to make mainstream media. Why? Because it does not agree with what the CDC wants to do. Who benefits from the CDC, right? You got to ask yourself that question. Google it, follow the money trail. All right, I'm not going to tell you what to think. I'm going to tell you what questions to ask. Who is motivated that everybody or most people test positive? Remember the statistics. 85 to 90% of the people that have tested positive would have tested negative if the test had the cycle threshold where it needed to be, okay? So draw your own conclusions from that. It is the weekend. Stay safe. I love you guys. I want you to be safe. If you are at risk, stay home. If you are not at risk, be good to yourself. Get out in public. Love on people. That's good for your emotions. That's good for your soul. That's good for your immune system. I want you well. I want you to stay well. And it is the weekend. Take care of yourself. Love you. Bye.